Hello everyone, my name is Akanksha Srivastava. I am an assistant professor of Balaji Law College, Pune University. Today, the topic for my presentation is victimization in India. So today I am going to tell you all who is a victim and what victimization actually means. Victimization refers to a person being made into a victim by someone else and can take on psychological as well as physical forms, both of which are damaging to victims. Forms of victimization include bullying or peer victimization, physical abuse, sexual abuse, verbal abuse, robbery, and assault. Some of these forms of victimizations are commonly associated with certain populations, but they can happen to others as well. For example, bullying or peer victimization is most commonly studied in children and adolescents, but also take place between adults. Although anyone may be victimized, particular group, for example, children and elderly individuals with disabilities, may be more susceptible to certain types of victimization. And as a result, to the symptoms and consequences that follow, individuals respond to victimization in a wide variety of ways. So noticeably, symptoms of victimization will vary from person to person. These symptoms may take on several different forms, for example, psychological, behavioral, or physical, be associated with specific forms of victimization, and be moderated by individual characteristics of victim or experiences after victimization. Symptoms of victimization may include negative physical, psychological, or behavioral consequences that are direct or indirect responses to victimization experiences. Symptoms in these categories sometimes overlap, are closely related, or cause each other. For example, a behavioral symptom such as an increase in aggressiveness or irritability may be a part of a particular psychological outcome, such as post-traumatic stress disorder. Much of the research on symptoms on victimization is cross-sectional. From a research perspective, this means that the symptoms are associated with victimization, but the causal relationship is not always established and alternate explanations have not been ruled out. Some of the symptoms described also may put individuals at risk for victimization. For example, there may be two-way relationship between victimization and certain internalism symptoms such as depression or withdrawal, such that victimization increases these symptoms and individuals exhibiting these symptoms may be targeted for victimization more than others. There can also be psychological problem. The experience of being victimized may cause an individual to feel vulnerable or helpless, as well as changing their views of the world and of their self-perception. The psychological distress this causes may manifest in a number of ways. Diagnosable physical disorders that are associated with victimization experience include depression, anxiety, and post-traumatic stress disorder, which is also known as PTSD. Psychological symptoms that are disruptive to a person's life may be present in some form even if they do not meet diagnostic criteria for a specific disorder. A variety of symptoms such as withdrawal, avoidance, and nightmares may be part of one of these diagnosable disorders and may occur in milder or more isolated form. Diagnosis of particular disorders require that these symptoms have a particular degree of severity and frequency, or that an individual exhibits a certain number of them in order to be formally diagnosed. Now, the second problem which may occur is depression. Depression has been found to be associated with many forms of victimization, including sexual victimization, violent crime, property crime, peer victimization, and domestic abuse. Indicators of depression include irritable or sad mood for prolonged period of time, lack of interest in most of the activities, significant changes in weight, appetite, activity, and sleep patterns, loss of energy and concentration, excessive feelings of guilt or worthlessness, and suicidality. The loss of energy, interest, and concentrations associated with depression may impact individuals who have experienced victimization academically or professionally. Depression can impact many other areas of a person's life as well, including interpersonal relationships and physical health. Now, the other thing can be anxiety. A connection between victimization and anxiety has been established for both children and adults. The particular type of anxiety studied in relation to victimization vary. Some research references anxiety as a general term, while the other research references more specific types such as social anxiety. The term anxiety covers a range of difficulties and several specific diagnoses, including panic attacks, phobias, and generalized anxiety disorder. Now, the other thing can be post-traumatic stress disorder, which is also known as PTSD. It is a specific anxiety order in response to a traumatic event in a person's life. It is often discussed in the context of mental health of combat veterans, but also occurs in individuals who have been traumatized in other ways, such as victimization. PTSD involves long-term intense fear, re-experiencing the traumatic event, nightmares, avoidance of reminders of the event, and being highly reactive, easily enraged or startled. It may include feeling detached from other people, self-guilt, and difficult sleeping. Individuals with PTSD may experience a number of symptoms similar to those experienced in both anxiety and depression. There can be other things. Additional symptoms of victimization may take on physical or behavioral form. These may be direct individual symptoms of victimization, or they may result from the psychological outcome described above. Physical. The most direct and obvious physical symptoms of victimization are injuries as a result of an aggressive physical action, such as assault or sexual victimization. Other physical symptoms that are not a result of injury may be indirectly caused by victimization through psychological or emotional responses. Physical symptoms with psychological or emotional basis are called psychosomatic symptoms. Common psychosomatic symptoms associated with victimization include headaches, stomach aches, and experiencing a higher frequency of illness such as cold or sore throats. Now, behavioral. Individuals who have been victimized may also exhibit behavioral symptoms after the experience. Some individuals who have been victimized shows externalizing behavior. For example, an individual who has not previously acted aggressively towards others may begin to do so after being victimized, such as when a child who has been bullied begins to bully others. Aggressive behaviors may be associated with PTSD. Then, substance use. Drug and alcohol use associated with victimization is sometimes explained as a form of self-medication or an attempt to elevate other symptoms resulting from victimization through substance use. Supporting this, alcohol use has been empirically connected to particular symptoms of post-traumatic stress disorder. Sexual abuse, in particular, has been identified as one significant precursor to serious alcohol use among women, although it is not as well established as casual links. Now, I just want to tell you all how many kind of or how many types of victimization is there. Specific type of victimization have been strongly linked to particular symptoms or outcomes. These symptoms are not exclusively associated with these forms of victimization but have been studied in association with them, possibly because their relevance to these specific victimization experiences. Now, the victimizations can be sexual. Some individuals who have experienced victimization may have difficulty establishing the maintaining intimate relationships. Now, the second can be childhood bullying. One symptom that has been associated particularly with school-based peer victimization is poor academic functioning. This symptom is not exclusive to peer victimization but is contextually relevant due to the setting in which such victimization takes place. Now, childhood physical abuse. Researchers have drawn connections between childhood physical abuse and tendencies towards violent and aggressive behavior, both during childhood and later in life. This aligns logically with increase in aggression and reactivity described above. The increased risk of engaging in aggressive behavior may be an indirect symptom mediated by changes in the way that individuals process social information. So this is what all I wanted to talk about victimization. And one thing I just want to add, that it is not only the girl today is victimized, but even it is the boy or a man is victimized. Now in India or in the entire world, we know about the male rape, we know about the male victimization, we know how the different legislations which are protecting women are adversely affecting the men. So we can say that victimization is gender neutral. Even a man can be a victim or a woman can be a victim. Thank you so much.